Hello, my name is Dr. Simon Arunga. I am a consultant eye specialist. I work at Dr. Arunga's Eye Hospital. You are most welcome. Today, we are going to look at different conditions of the eye. We will start with a condition called cataract. Cataract is the leading cause of blindness all over the world. Here before us, we have these eye models, which show the different parts of the eye. Now the eye has the front part, and then it has the body, which is this one, and then it has the behind part. Inside the eye, when you open it up like this, it looks like this. The front part is this structure, and then it has the middle part, which is this, and it has the behind part, which is the communication between the eye and the brain. Inside here is a very special structure. It's called the lens of the eye. If you're to look at this eye model here, the larger model, the lens of the eye looks like this. Now, this lens is very clear. It is like glass. And the reason is so that light can pass through and go behind the eye. This lens is the one that is responsible for you seeing clearly at different distances. You can see far and you can see near. Now, there are some conditions which can cause this lens to lose its clarity and become opaque. When the lens becomes opaque, we call it cataract. Different things cause cataract, but the most common one is age. Age is the leading cause of cataract. As people grow older, then their lens stops being clear and develops cataract. Now, how do we treat cataract? We treat cataract by removing the natural lens, which now has become opaque, and we replace it with a very clear brand new lens so that the eye can see again. There are two methods for removing this lens. The first one is called the manual method. The manual method means that the doctor will cut here. Once they finish cutting here, then they create a passage. And through that passage, then the doctor can remove this lens, which is not working anymore, and they replace with a new lens so that you can see. This manual method has been around for some time. It is less expensive. However, it takes longer for someone to recover. Another method, which is a newer method, is called the computerized method. In science, we call it phacoemulsification. This one does not need cutting. We use a special probe which comes here on the edge of the eye and introduces vacuum. That vacuum can suck out the lens that is opaque, and then through the same opening, it's a very small opening, we put in a brand new lens. Once that lens enters the eye, it opens nicely and then sits where it should sit. That one is called the computerized method. The advantage is that there is no cutting and recovery is faster. If someone undergoes this procedure, they are able to go back to work and back to office within a day or two after the procedure. Here, I want to show you a picture of one of our patients. As you can see, this is a normal eye. And in the center where the lens is located, it is very clear. You can see through very well. And also, here is another picture of another patient who has a cataract. And as you can see, the center is not clear. You can see the opacity, which means this person has developed a cataract. To explain further, I have here a diagram showing the two types of the surgery. The first one, as you can see, the doctor has made a cut on the eye. They have gone through that cut to remove the cataract. And using the same cut, they are now inserting a new lens. On this other side, in this other diagram, you can see that there is no need to make any cut on the eye. The doctor has used a probe which has gone in and sucked out the cataract using vacuum. And now, through the same small hole, the doctor has injected a brand new lens. So the patient who has received this computerized surgery will heal faster and go back to work faster than the one who has received the manual surgery. As we have seen, the treatment for cataract is available and is very safe. I remain Dr. Simon Arunga. My team and I are available for you to ask if you have any further questions about cataract. Thank you.